Hi, everyone. This is Helen. Just want to give you a quick warning that we had some technical difficulties the first 3 minutes of this podcast. Please hang in there. I promise you it's a wonderful topic and a wonderful discussion. So hang in there past the 3-minute mark and we should be good. You should be hearing fantastic sound quality like you always will. All right. Thank you. Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi there, Wellness Wednesday listeners. This is Helen Nguyen back in the studio. Today I have the privilege of sitting down in the studio with our newest, one of our new physician assistants, Heather. Hi, Heather.
Hi.
You guys, she's adorable. So if you haven't made an appointment to come in to meet her, you should. So I just thought it would be really wonderful to get her onto the podcast and to let you just know more about Heather, where she's from. Spoiler alert, she's not local. But she's come to really enjoy the Pacific Northwest, right, Heather?
Mm-hmm.
Yeah.
Yeah, I love it.
Okay, well, let's just dive in. Who are you? Where do you come from? Why are you out here?
All right, sure.
Yeah.
I'm Heather Diebler. I've been a PA for about 20 years. And originally I started practicing in upstate New York.
I didn't know that.
Yeah, in the Adirondacks.
Wow.
And then moved to North Carolina and got into PA education. But my husband's from the Pacific Northwest, so he's from Spokane originally, and he has a lot of family in Seattle, and it's always been our favorite city in the country.
Wow.
So when the opportunity came to work here and live here, we jumped at it.
Oh, wonderful. Has it been nice?
Yes.
Has it been a good transition?
Yes, it has been.
Wonderful. And then, so just more about you. How did you get into medicine? What was interesting to you and why PA?
Sure. Well, I pretty much knew from the time I was 10 years old that I wanted to go into medicine. I just felt like it was a calling. I was just really interested in the human body and healing and just wanted to get into the medical field. At first, I thought I wanted to be a pediatrician and then maybe a veterinarian. But as the years went on, I started hearing about PAs, and I met several PAs in the Adirondacks, where my mom's from in upstate New York. It's a very rural area up there, and
lots of PAs practice primary care there. And so that was where I first learned about the profession. Just in talking to different friends who are doctors, they felt like PA was a great career, especially if you didn't want to be in school for like 7 years more.
I know. That's a
after
long time.
college.
If you really think about it, that's a long time, right?
Yeah.
How long is PA school?
PA school is 28 months.
Wow.
Yeah. You have to have a bachelor's degree first.
Yes.
And then
I'm sure.
usually they encourage you to have at least 1,000 hours of patient care experience first.
Yeah.
And then it's a very fast track medical school.
Wow.
For 28 months.
And what was your focus in PA school? Is there a focus in PA actually?
Most PA schools are kind of generalist PA schools so that you really are trained with a primary care focus.
Okay.
But you can go into any specialty.
Okay.
Because really whatever specialty your collaborating physician has, you can go into that specialty.
Wonderful. What do you enjoy most about being a PA?
I really enjoy getting to know the patients and just serving them, loving them. I really love to get involved with underserved communities. I feel like there's just a different atmosphere there, and there's a great need, and that's what I really love.
I remember you talking about some of your passions and during the interviewing process, and you talked about going on mission trips before, right?
Yeah. I've been on a couple really great mission trips in Africa. I went to West Africa during PA school, and then Kenya just last year.
Wow, I didn't know that.
Yeah. I got to go to Kenya for a few weeks just to lead students there that I was working with in my previous PA program, but also just to serve there as well.
Was there any part in your PA journey, did you go, I don't know if this is what I want to do? Was there any time where you're like, this is not what I signed up for? Or you just knew this is your thing?
I just always knew it was my thing.
That's so good, though.
Yeah. Yeah, I mean, I will say in the rotations when I got into the OR, and PA students are kind of the lowest man on the
why
in the pecking order there.
Really?
Yeah.
Oh gosh.
So you really are holding a retractor most of the time, and it's kind of backbreaking. And so I knew that probably surgery wasn't what I wanted to go into.
Okay.
And plus the patient is unconscious, and you can't really get to know the patient too well.
That's a really hard conversation to have. Yes.
Yeah. Table. So I knew I wanted to work with conscious patients.
Yes. Fantastic.
So I knew that wasn't my specialty, but
yeah. What would you? So I have a cousin that's interested in PA, becoming a PA. What would you say to a young person that's like interested in becoming a PA? What are some things that they should look out for, or things that you've learned as you
things that I've learned?
Yeah, as you've gone through this PA journey. Yeah.
I think people who are interested in being a PA should definitely do a lot of research into the field. Get to know as many PAs as they can, like shadow PAs, work in the medical field as much as they can, either volunteer or, get your medical assisting certificate, or your, nurse assistant certificate, or EMT, paramedic, different fields like that. People should know that medicine it really should be a calling. It shouldn't really be something that you go into thinking, well, I think you can make a lot of money doing that. And so that's what I want to do. It's more, it's really a calling. And I feel like if you go into it for the wrong reasons, or, I mean, it's a great career and you can make money, but that's not going to last long. People are going to burn out.
Yeah.
So it's really important to know if it's your calling before you go into it.
I feel like I had no idea PAs was even a thing growing up. I had no idea. And maybe that's because that was very foolish of me to think. But I was always interested in medicine, and I just didn't even know this track existed for a lot of people. You hear the stories of like how much debt you're going to have to go into to go to, become a medical professional, and then the time invested, right? So you have to put a lot of things that you are also called to do on the back burner, like having a family, having kids, and all of that stuff. And it sounds like stepping into the PA world, you can have all of that and still be a very successful medical provider.
So yeah, I think that having a family and also having a career as a PA is doable. Yeah.
Well,
and I think
you
that's
seem to be doing it lovely.
Oh, thanks.
From my side of things, I think you're doing a fantastic job.
Thank you. Working in medicine is it doesn't typically go away once you leave the office. Things will come, follow you home.
Yes.
And so that's something that, anyone going into medicine has to be willing to commit to.
Yes. I come from a family of medical providers, and when I first adopted my son and, just, what medicine do I give him? So I called my aunt, that's the pharmacist, and then what is this red bump that he has? And I call my aunt, that's the baby nurse, and so it's fantastic to have.
Yeah, it was really nice to have.
You'll probably get a call from me one of these days, Heather. But
that's fine.
I'm glad. I have you on tape now, so yes, I'm going to hold you to it. How has your experience been at 3W? You've been such a breath of fresh air for us, really, truly. I know that stepping into a mission like 3W can be a lot. Just being in this field for a long time, it's not just, medicine is not linear, it's all over the place. It's gray most of the time.
Right.
And then our population, the community we serve, there are layers to the patients that come in. They're complex, and sometimes it's a difficult conversation, and it's a privilege to be in that position, and that's why we're here. But for you, has that been difficult? Has that been fulfilling, not fulfilling, very easy? How has that been for you stepping into kind of our world?
Yeah, it's been incredibly fulfilling, actually.
Oh, good.
I think I met you through a conference.
Yes.
I was working in my other role as a clinical education manager at the university, at Northwest University, and I went to the same conference that 3W did. And I heard your presentation, and I just, I felt really called to work with you guys, and I just felt like that's where I need to be, and I didn't know if that would be a yes, but I just kept kind of knocking on the door until it opened. So,
yes, of course.
Yeah. And so I think what drew me to 3W was it's not focused on making money. First of all, it's focused on serving the patients. I really have a problem with so much of our system is focused on profiting off of, healthcare. And I think not at 3W, but in the entire country, our system has a lot of profit in healthcare. And I hate that. I honestly do hate it.
Yeah.
And so I love the fact that this clinic is here for a different reason, to serve and to love patients in some of their most difficult moments, and to really fill a role in a place where there's really no other clinic like this in this part of Seattle, and maybe more than just this part of Seattle, but all of Seattle. So just love the fact that I can spend more time with my patients and just really show them that love and respect that they crave and need.
Yeah. Well, you've just been I keep saying it, but you've just been such a wonderful addition to our team, and I just really appreciate you. I'm so glad we ran into you during that conference. I feel like it was very meant to be.
Yes.
And just like when Lauren was there too, and when you said, well, my family might be moving out to the Pacific Northwest, we're like, okay, noted. We need to talk to her later. So even though you were knocking on our door, I don't think there was much of a door there, to be quite honest. The team has just been really grateful to work with you and getting to know you more. And you definitely have a heart for the population that we serve and continue to call to serve. The women that we serve are just very appreciative. I'm thanking on their behalf to you.
Thank you.
Yeah. And so in your short time here with 3W, what do you see as a big need that women are facing when it comes to women's healthcare specifically, in your opinion? What has been something you're like, whoa, there's a pattern here that I'm seeing?
There's a really just kind of a shortage of primary care that's really directed at meeting women's needs. I think that a lot of women's health is focused too much on sort of what makes life easier but then not in the long run. Perhaps there's some long-term problems that can develop from life being made easier.
Yeah, the Band-Aid approach.
Right, the Band-Aid approach. Yeah. And I think also just consistency. I've heard stories of patients saying, I went to this one doctor and they told me this, and then I went to another doctor and they told me something opposite, and a third one. And finally, I'm here because I need to ask a lot of questions, and I need some things explained to me, and nothing makes sense. So just being able to spend time with patients and just give them decent education and give them, the evidence that's actually there, and like why we're going to recommend one thing versus another is really important. I think that patients are just getting a lot of conflicting information out there, and a lot of it, again, like you said, the Band-Aid approach, or just what's fastest, what can get the most patients through the office as fast as you can.
Right. What codes do you have to? They just said how many codes just came out of what they just said, or yeah, I totally get that. Yeah, I mean, I'm definitely not a shrinking violet. Not to say that's a bad thing, but I'm definitely someone that when I go to a medical appointment, I feel very confident being able to advocate for myself. But even in my infertility journey of going to the doctors, there were moments where I was not in a position where I felt strong enough to advocate for myself. And I put myself in our patients' shoes sometimes when they're dealing with such complex personal issues on top of mental health issues, probably. And then now a physical thing is presenting itself. How do we as healthcare professionals, how does you as healthcare professionals come alongside them and say, okay, we don't have to have all the answers right now. How are you? And what can we do today? Because so much of it is that conversation. Right. And I'm so glad that we're able to provide that hour-long unrushed care, and then you can come back tomorrow too if your time runs out, right? It's not like something that, okay, it's a one-time thing. And I think that's the luxury that we get to offer to our patient population, and I wish more and more people could offer that. But unfortunately, medicine has been very transactional.
Right.
Become very transactional. So I'm so glad and grateful that you get it, that you just get what we're trying to do and have come onto our medical team and be that provider that our community really needs. And I'm so glad you're here. I'm sure you're gonna continue to change lives, transform lives. And that's why 3W exists, is because that's what we want to do for the women here. So we'll have you back for another topic, but I just really wanted to, officially introduce you to our patient population, to our donors who make it possible for you to be here, our wonderful, generous donors that allow us to provide a living wage for our medical providers and our staff, right? Without you, it just wouldn't happen. So thank you to all the folks all the stars that aligned to have Heather here today. I'm really just grateful for that. And I hope she stays with us forever. That's also recorded. And just thank you, Heather. Thank you for being here with us.
Thank you for having me.
Yeah. All right, folks, if you're curious about Heather, come on in for an appointment. Make an appointment with us. Super easy to do. Go ahead and make an appointment online. Give us a call and come in and meet our new PA, Heather. Thank you, Heather.
Thanks.
For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.